most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
We're
therapist.
the most famous physical therapists on the internet.
In our opinion, of course, Bob.
The question is, the topic is, will simple hanging help your shoulder pain? Hanging.
Hanging.
Yes.
Or brachiating.
Brachiating, yes.
Yes.
So this is shoulder pain. We're talking about rotator cuff injury, impingement, tendonitis, bursitis, maybe even a frozen shoulder if it's in its last stage.
Yes.
In the thawing phase. We became aware of this several years ago. We were skeptical. What did you say, Brad?
As a matter of fact, I think I found it on a comment. And I sent it from a viewer. I sent it to you, and then you ordered the book.
Right.
And it's like, what kind of hocus
crazy
pocus
thing
is this? And now
I was intrigued, but
Yeah.
I did not believe it. And the book is written by Dr. John M. Kirsch. I've actually had some email exchanges with him right now. He's a retired board certified orthopedic surgeon. His book is called Shoulder Pain, ? The Solution and Prevention. And it outlines why hanging is beneficial. And he also did a study, there was a study done on it.
Right.
It's a little vague. He talks about it in the book at fairly good length, but I have not been able to find this study, so take it for what it's worth. It was done in Kauai, so that's one of the islands of Hawaii. There was 92 participants, and they had had shoulder pain for years.
Sure.
Most of them had been advised to have surgery.
Right.
So of this, 2 of them dropped out because they quit for personal reasons. But 72 had impingement syndrome.
Very common.
Yep. 16 had rotator cuff tears, and this was verified by MRI.
Yes.
So, and 4 had a frozen shoulder. So all 90 after they were doing the hanging, they returned to a comfortable, what we call ADLs, which means they were
activities of daily living. They could function as they would for all the activities you have to do to live. Clean your house.
Drive your car.
Right.
I mean, whatever daily living involves. So, and 3 of them canceled shoulder replacement surgery.
Sure.
So,
Yeah.
in other words, this is pretty good results, if you ask me.
It is.
I haven't found any other studies on this. So that makes me worry about a little bit. But anecdotally, it's been really helping the patients I've used it on.
Right.
And it's certainly helped me.
And the testimonials we'll get into.
Yeah, we're going to give some testimonials too. He sent me, there's some testimonials in his book, and he also sent me there must be, what are there here, Brad? There must be 30, 40 testimonials.
Of people successful hanging, and we both love it. We've had numerous people comment back on our YouTube channel thanking us for the videos and the success they're having.
Yeah, and you may say, well, that's not very scientific, but some of these people are so there's
thankful.
Yeah, so thankful.
The gratitude.
Is unbelievable because they went from, possibly going to have surgery or just really living a miserable lifestyle to having freedom and no pain. So you're going to avoid hanging if you have an unstable or dislocating shoulders.
Sure.
And also if you have severe osteoporosis.
Right. Unstable bones.
Yeah. Also, he said if you have poor health, you should see your doctor first before you do this. You may want to see your doctor either way on this before you go ahead.
Obviously, you have to have a fairly good grip strength.
There are variations to that, and we'll talk about that.
Sure.
But what we're trying to do through hanging, there's what we call the subacromial space, and
should we give a brief description of what hanging is in case someone's just haven't heard this?
Go ahead, right now.
It's simply like a pull-up bar is a good place to hang. You just simply grab the bar and let your body weight hang through your arms and relax your shoulders. And you'll hang there to start out with maybe 10 seconds, but you'll build it up.
Yeah.
And that's simply
all. That's it.
That's it. You do that a few times a day. It depends on how you tolerate it initially and
find a tree branch. And
actually, he says some people actually have done that.
So what we're trying to do, we're trying to stretch out what we call the coracoid acromial ligament. Did I say it right? Corco?
Caracoacromial.
So,
Well, that's a potato thing.
yeah, okay. And we can also sometimes reshape the acromion. Think about it, just like people, like the orthodontist could straighten or shift your teeth.
Right.
The same thing for the bones up there. If you put enough stress on them, you can reshape them
Right.
and possibly create a larger opening for the tendons to go through.
Exactly.
And there's less stress than on the tendons. I'm getting technical. I didn't want to get too technical because
It's not that important for
it's
progress.
not that important. You're
Right.
going to see if your symptoms allow you to do this,
Right.
and give it a try. So right now we're going to go ahead and read some of the testimonials.
Oh, yeah.
Because I think they carry some weight. And Mike's going to switch the boards then, right? So, Brad, do you want to read the first one?
Yeah, this first one I like. This guy was a 25-year-old snowboarder, had an accident, injured his shoulder. They're talking about surgery, and it wasn't, and here it goes. It wasn't until 2 days before the surgery that I found this book and decided to cancel or postpone the surgery for the one last shot. And then he found out, he goes through a couple paragraphs, but the bottom line is it works. He said he just is in love with this book. It changed his whole, life from not having surgery scheduled 2 days before and having a complete heal, a
Yep.
complete rotator cuff rehab.
So I love this one. Very quickly got me back to the kind of life I thought I'd lost forever. This was a 1-year update then. Still a freaking miracle. And I like this. And this old lady will arm wrestle all naysayers. If you aren't already hanging, but are taking the time to read this review, just buy the book. And she goes on and on. But I mean,
Right.
so
And this is not an expensive book. I was at $10
no.
or $15 or something.
right.
You got.
Yeah,
I got another
one?
one. This is a 73-year-old gentleman. He said he found the book to be engaging, practical, and clinically scientific. He had a CT scan, found problems with his rotator cuff. I'm not getting into all the details, but he started hanging, and after 5 months, he found consistent and steady progress, and he's much more and back to normal activity without near the shoulder pain he was. He highly advocates this.
All right, I'll give another one. Total miracle for a non-believer. This book looks hokey, but just buy it. Knowing how well it works, this was worth a fortune to me. It was other reviewers here and on YouTube that convinced him to try it after 10 months of pain and life limitations from a torn rotator cuff and severely frozen shoulder. So, I mean, like I said, a lot of these people are just so... couldn't say enough about it.
They're just doing this because they want to help other people.
They want to help other people.
Exactly.
Here's one from a therapist, actually. Thank you so much for your amazing book and research on shoulder pain. I began using your hanging technique with great success in my physical therapy practice. So, you got anything more, Brad, that you want to add?
Well, I didn't know if we wanted to keep on.
Yeah, there's a lot.
Yes. I mean, we got one from a CrossFit coach, weightlifter, trainer, lifetime athlete. He corrected his. The book has I don't know how many testimonials in itself,
right.
too. So, it's not a really big book. I mean, it's a relatively quick read, and he has it written for the layperson.
Yeah, and it's a lot of it is repetitive. But he also goes into some strengthening exercises that you can add into too. So we're going to go ahead and show you. Well, let's talk about what he recommends first, Brad, and then we'll show you on our hanging handles how we do it. But basically, he recommends you start off. He said there's really not specifically a right way and wrong way. You're going to experiment how long and how often you're going to experiment. I saw one guy, he had good success. He hung this twice a day for 35 seconds. That's all he did.
Yeah.
So, and he had great success.
Yeah.
And it seems like sometimes the beefier guys have to hang longer because their bones are thicker.
Sure.
You know what I mean?
Well, they got to, and those ligaments takes more time, and the muscles probably take time to relax and stretch, etc.
But he recommends 10 seconds to start with a 60-second rest.
Yep.
Your palms are forward, and then you can have partial weight or full weight. You don't have to hang completely. You can still have your feet on the ground.
Exactly.
He said remove jewelry. You can use gloves. I use a golfing glove to do my pull-ups. You know, on both hands.
To protect your.
It's just easier. Your grip's so much better.
Yeah, sure.
You know, and there are what we call lifting hooks. I didn't like them. Mike, did you like them? No, Mike didn't like them either.
They go around your wrist, Velcro around your wrist, and then you actually don't even have to use your hand grip at all.
If you have really bad arthritic fingers,
yeah,
it's possible you may want to try, you know, you have to order weightlifting hooks, they're called. But again, I didn't like them. Let's see. Oh, my experience, again, initial pain and discomfort, he said his experience is that most experience a little bit of pain and discomfort right away, but it tends to diminish after a few moments.
Right.
So.
Or, you know, maybe the second or third day. I've seen some people report that. But, boy, I just had a comment this morning or last night, you know, reading the comments, and someone was just so thankful, and they said they started it, and, you know, within the first day they noticed changes, positive changes, and they're continuing on it. So
now, Dr. Kirsch says it will not damage your shoulder or further damage a rotator cuff tear.
Okay.
So, you know, I have to agree with what he says because I have not seen it so far that it causes any problems.
And if you're a therapist and you want to know the details of the mechanics of it, he does go through that in the book, and he talks about, because when I thought, well, that's just going to chew up the supraspinatus tendon.
Right.
And then he explains why it doesn't do it.
It
and
clears.
It makes sense.
Yeah.
It really does.
So eventually you want to get up to maybe 10 to 30 second hangs, and you know, you can do it as long as over a 10, 15 minute period. I don't think people got to go that long, Brad. Do you?
Well, I go 20 seconds, maybe 30. But my shoulders are tight, but I don't have any particular problems. The one guy in the book I remember is...
one guy had trouble.
Well, no, I'm talking about, there's a gentleman he talked about, it wasn't the most recent edition, and he had the hooks.
Oh, sure.
And he reported he'd hang up to 5 minutes, which is an extreme.
Yeah, that's an extreme.
But it felt good. I mean, he wasn't experiencing pain. His grip was not strong enough, so the hooks around the wrist worked good, and it works great for him.
Yeah,
so.
I just know he mentioned also a weightlifter, former weightlifter, that was huge. And his bones were so big and thick, and the ligaments were so thick that he had to hang a lot longer too because of that. So we're going to show you an alternative here for hanging. We got hanging handles that Brad and I actually invented. We think it's great for posture. We think it's good for your back.
Decompression
your back.
Traction.
But these are great if you don't have a lot of room, you don't have room for a pull-up bar. You can just if you have a couple studs you can put these into.
Yeah, they're behind the drywall.
Yeah, so we'll end the podcast now. Glad to see you. Glad to have you follow us. And for those of you on video, we'll show you the hanging handles.
There you go. All right, walk this way. So here we have, you need to have, with our kit you get a wall anchor. We've got one down here. This is for banding. You'll mount them up here. You have to have a wall that has wooden studs, 2x4s, 2x6s, whatever it may be. And that's the way it's designed. You have to have that. You need to find the stud, and we have a video as well, instructions with the kit on how to properly put them in. We're not going to go through that. So we have them installed here, 2 of them here. We have a third one over here. I would probably move this over here if I was hanging here a lot. Bob likes his closer together because it feels better on his shoulders. Again, palms away from the wall, and you simply grab it. And we mentioned that you may not start hanging with 100% of your weight off of your feet. You may start, you can see I'm sliding down, and I've got maybe 50%. And you may start there the first day you do it, 15 to 20, 30 seconds. Or even start at 10.
Yeah.
It really depends on how your shoulders feel. If it's like 10 seconds and it's starting to hurt, give it a little break. And then, give it 30 seconds or a minute. Then go back and hang for another 10 seconds. Like I said, I go for about 20 seconds. I keep my feet here. I'm not 100% weight bearing. Mine's a maintenance program. And I just hang. I'll do this when I'm doing my exercises.
Brad, I'm going to show another variation
Sure.
too. That you can actually have your body facing the wall, like this, and you like this, and it's just a little bit different.
Yep.
Like if you can't get your shoulders all the way up there,
Sure,
you know what I mean?
right.
You can start like this.
And I think that's one of the advantages of using our system on the wall.
Right.
You have the wall when I was doing it, it offers posture,
Right.
decompression. This doesn't do the posture benefits, but it does change the stress on the shoulder and the back too.
And you can even do one arm hanging
Sure.
or hang like this, or even go like this
Yep,
to
yep.
get a little more stress on
Yeah,
the arm there.
yeah.
So
And again, you're going to experiment with these different variations, and you'll know because your shoulders will clearly feel better one way or another, or you might want to just break it up from
and
you know,
make
week
sure,
to week.
whatever happens, either way, let us know, because we
Yes.
like to hear negatives too, because
Yep.
that's how we get feedback and that's how we learn.
Yep, and we
So-
can improve our products as such.
So thanks a lot for watching.